Your teenage child has been diagnosed with functional neurological disorder, short for FND, and you as a parent are on a quest to find the solution. What is the best treatment for your child? Hi there, I'm Dr. Jean Lee, a pediatric psychologist and chronic pain survivor myself. My mission is to help teens and their parents resolve persistent physical symptoms such as chronic pain and FND so that they can get back to their life and feel like normal again, because I truly believe that every teen deserves so much more in their life. If you're new to this channel, make sure to click the link below to download a free PDF parenting guide to help your teens who struggles with chronic pain or FND at home. So the link is in the description box below. All right, so today's topic is how is teen FND treated? I want to quickly talk about what is FND. FND or FNSD, functional neurological disorder or functional neurological symptom disorder, depending on who you talk to, is an umbrella term to describe these cross-wired problems between the brain and the body when physically the structural damage is not there. That doesn't mean it's not real. It is a real diagnosis. And FND is a number 2 diagnosis that you would get in neurology clinic next to headaches and migraines. And as you can imagine, there is no one reason why FND happens to everybody. So there isn't any universal cause. It's multifactorial, and in fact, it is a biological, psychological, and social component. And I do have a video describing what that is, so check that video as well. All right, so get to the treatment of FND. Really, the conclusion is it really depends, because just like the cause, there is no one-size-fits-all treatment for all FND, because FND has so many different subcategories, combination of these things, and so many different things going on. And that being said, as of today, which is June of 2023, there is no medication that treats the FND directly. So there is no medication to treat this. So if you were hoping that there is a magic pill out there, there isn't any. In fact, if you find one, I would love to know what that is. So that being said, who can treat FND? Well, it's typically one or two or all of these 3 category providers. One is psychology like myself, and then physical therapy and occupational therapy. So assuming you're seeing one of these 3 providers or all of the providers, the typical overarching goals are as follows. One is to know what FND is. So there's a heavy duty psychoeducation stuff going on because you really need to know what FND is. And in fact, this is the first step in treating FND almost universally. So I said there is no one size fits all. If anything that fits everyone is to know what FND is, okay? And number 2 is to learn how to manage or solve FND symptoms. So things like strategies to rebalance the autonomic nervous system in your body, retraining the brain's cross-wired problems, and then strategies to return to your life. And then the third component is tackling underlying triggers. So this could be biological triggers, psychological triggers, or social triggers, as I mentioned. FND is multifactorial and it's biological, psychological, social components, almost like starting a fire. You have to have an oxygen and source and then the heat, right? So kind of like that, FND also has these 3 components to it, and you have to address what those underlying triggers are so then you are maximizing a chance of preventing or minimizing your FND symptoms coming on again in the future. Okay, so I want to talk about this case study. This is one of the patients I treated way back when, but just to protect the personal information, I am disguising information intentionally to give you the gist of the clinical picture and then what happened throughout the treatment. Okay, so this was a 10-year-old female who was diagnosed with FND, and her FND symptoms are as follows: paralysis. She also had a syncope, so passing out and then having seizures, headaches, and mood changes. So when I saw her, I followed these 3 prongs treatment: psychoeducation, strategies, and underlying triggers. So psychoeducation wise, I was focusing on teaching what FND is, not only to my patient, but the parents, siblings, school teachers, providers who were working with this individual, so then we're all on the same page. So that was a huge component to it. And then how is her FND seizures were different from epileptic seizures, that kind of thing. All right. And then we spent a lot of time on working on strategies. So for her, what worked out was a combination of medication in the initial stage of the treatment, not to treat FND itself. As I mentioned, there isn't any medication to treat FND directly, but she was having a lot of anxiety symptoms. So to manage the anxiety symptoms, so she was able to apply other strategies because her anxiety level was a little bit down. And so there was a little bit of medication in the beginning, and then tons and tons of relaxation strategies to rebalance the autonomic nervous system. And then a lot of plan around school, because she was having really hard time going to school, missing schools, missing classes, and that was becoming a lot of stress for her as well. So a lot of conversation with the school teachers and administrators, tons and tons of cognitive behavioral therapy techniques, and then something called acceptance and commitment therapy ACT techniques. And we worked on her sleep, which was pretty bad. So there are so many different strategies going on, and we were tackling one by one. And when she was able to manage and basically resolve all of her FND symptoms, then we went on to these underlying triggers. So what happened was, for her in particular, in the process of treatment, we discovered she actually had autoimmune disease, which could have been one of the triggering factors for her FND. And then we also discovered that she had very, very high expectations at school, sports, and other areas of her life, coming from herself, and a little bit of that flavored components from her parents, extended family members, and school teachers as well. Everyone was so lovely working with, but there was this unspoken agreement that she had to be at the top of everything, right? And related to that, she had this mindset of very, very perfectionistic, which is oddly, but coincidentally, very common in teens who have FND. And then she had this thinking pattern of all or nothing. So if she was not perfect, then what's the point? So there wasn't anything in between. So during that stage of managing and resolving FND symptoms, as I mentioned, she learned all of these cognitive behavioral therapy techniques. So when we got to these underlying triggers, she was able to use these strategies that she has learned into these underlying triggers. So she was able to prevent her from having these FND symptoms in the future again. So this treatment took almost, I want to say, a year or so. It was pretty elongated process, partially because of figuring out the medical underlying concerns and working with the school, and there was a transition period and all kinds of stuff going on. So it took her a little bit of time, but in the end, she has been FND free for quite some time when I met her for a follow-up down the road. So what am I going to say here? The moral of the story is the FND is very real, legit condition, scary, terrifying, and debilitating condition and diagnosis. But with the right approach, it can be very well managed, if not resolved. So if you are thinking your child is going to have this life with this condition for the rest of her, his, or their life, I would say hold that thought, because there might be a hope here. So my recommendation to you is, number one, your child's FND diagnosis is correct. And number two, know what FND is. Instead of refusing the diagnosis and then going on this quest to find this hidden diagnosis, which may be the case, but as soon as you get the diagnosis of FND, my suggestion is to work with the specialist who is very well versed in FND treatment. And I do have some resources down in the description below, so you might be able to find a provider in your area. In conclusion, FND is absolutely legit, real, debilitating, terrifying condition, but with the right treatment approach, it can be well managed, if not resolved. And FND is so much more than just in your head or psychological or trauma phenomenon, because it's a lot more complex than that. If you and your bright child are ready to tackle the FND conditions through step-by-step actionable solutions, then you may be a good fit for my program. Click the link below to schedule a call to talk to me directly so that we can figure out if you qualify for my program. Well, thank you so much for watching this video, and I will see you in the next video.